Sadhguru pranams from the other side of the globe. These pandemic times has thrown an avalanche of mental, emotional, health and economic strains on all of us. You have been guiding us and telling us how to go about these stressful times. Today I would like to ask your opinion on a few matters related to the psych and mental tribulations of the medical field and also the patients who are affected with this. Thank you very much, Sadhguru, for this opportunity. Sadhguru, this pandemic has taken away the lives of nearly 900,000 people. Millions have been affected. There is a worldwide slump and mental agony. In most of the religions, and especially in Hinduism, we have always been taught to look at things as a cause and effect relationship. So do you think that this global pandemic is a collective karma? Because all of us are looking at it in different aspects. The doctor looks at it as a viral infection. Economists are looking at it as a financial disaster. Sociologists are looking at it as an upheaval. But my question is, how does a yogi like you, a mystic, look at a global upheaval as this? Is it predetermined?
Well, is it predetermined? Definitely not. If we could have avoided eating bats. But now we were enjoying this connectedness of the world, that you out of your conferences, me out of my programs and work. Today we're in this country, another day we're in another country. I know that you go in and out of Europe, America in 1 day, 2 days and back home, all this. Plus of course technology, see now we are connected. We've been enjoying this. I wanted to just look back and see, if this virus had happened in Wuhan 1,000 years ago, it would have been a minor incident there like common cold or something. It would have happened, a few people maybe would have lost their lives. But today it's a global pandemic, not because virus is flying all around, we are flying all around, all right? So is it a collective karma or not? Definitely it is. It is our collective karma. We were enjoying this process, but we must understand there is also a flip side to everything. About pandemic being such a massive impact on our lives, there's no question it has an impact. It has a very big impact on our economic structures, social structures, infrastructure as a whole, as we have. All this are natural and existentially right. But you talking about a mental pandemic now, about psychological struggles, these are entirely ours. I'm not a part of that, part of the pandemic. Economic structures for us also, everything, the revenue for the foundation is totally gone. So we are, many people in the ashram, it's not yet necessary, but they preempt everything. Many of them are taking off 1 meal in a week. Like this, people are taking steps within the foundation and they're contributing it to Kaveri calling, doing something like this. They've always been doing, but they're much more conscientious now, knowing that this could… right now we've been serving food for months for many people who are near starvation, but this could come to us also. This very easily could come to us. So, economic upheaval, yes, it is there, social upheaval, it is there. Infrastructural lapses are being visible like never before. But psychological upheaval is our choice. That we don't do. Psychologically, we're in a very good place because we don't have to travel now, we're sitting in one place, we're doing a lot of work, lot of creative things are happening, we are rebuilding the whole foundation for which we never had time because it was always a running machine. Now it has slowed down. So we have a lot of time to do many things, both with ourselves and with the situations around us. So this is a choice that we have. What the world throws at us is not our choice always. What we make out of it is our choice. This choice we must exercise. Instead of exercising the choices that we have, we try to exercise and lament about choices that we don't have. So, taking charge of your physiological and psychological health is a fundamental thing that human beings should always do, but they don't. They think doctors will take care. I'm sorry if I'm saying something wrong, because doctors are supposed to take care, but no doctor can give you health. They can assist you in illness. When broken bones, we will have to come to you. Can you make me grow good bones? I don't think so, I have to do it myself. So similarly with every aspect of health, health is individual responsibility. When illness touches us for whatever reasons, then of course there is a doctor. But right now we have misunderstood this whole thing and we are repeating the same old karma again and again and again. If I can… I don't know if whether I can crack a joke with a doctor because it's serious business. This happened here in Tennessee, that a man went for a shave, you know. In this part of the country, usually people don't shave at home, they go to a barber for a daily shave. Or they shave every alternate day or every 3 days depending on the growth of their beards, how it grows. So, you know, I have eliminated such problems in my life. So he went for a shave and barber said, see, I've come up with a new methodology that if you keep a golf ball in your mouth, in your cheek, I can give you a real clean shave. So the man sat with a golf ball in his mouth and he got a real clean shave. After the shave was over, he said, for a moment when I was lying on your chair, I almost swallowed the ball. What would happen if I swallow the ball? The barber said, no issue, you can bring it back after 2 days like everybody else does. So karma is being repeated again and again, we don't seem to learn. Karma means it's the experience of our action, physical, mental, thought, emotion, energy levels, we perform action all the time. This experience should evolve our action, our karma should evolve as we grow, it should grow into higher and higher possibilities. But if we repeat the same golf ball over and over again, you know what's going into us. So unfortunately, human beings have, you know, technology is going through the ceiling, all kinds of things that we could not imagine 25 years ago are all living realities in our life. Look at me and you talking, you know, across the globe, we're talking to each other. Was this possible? Was it even imaginable 25 years ago? When you were studying for your medicine, did you imagine that you will talk to somebody, another part of the world, and you will diagnose them from where you're sitting? Was it even in thought it was not possible? So all this has come, technological upgrade is happening like incredible, but human upgrade is not happening. This is why spiritual process, yoga becomes very important, because this is about upgrading our lives, how we are, we must upgrade. Only if we upgrade, we enjoy an upgraded life. Otherwise, everything else is upgraded, we have not. See, right now, people were all complaining they don't have family time, they got family time and they're fighting with each other. People were all complaining, every day I'm stuck in the traffic, no traffic, you're at home, you're getting frustrated because of no traffic. So the problem is not of the world, the problem is of human beings, because there is only one problem on the planet, that is the human being. It is only by transforming individual human being can you bring about some change in the world. Talking about change in the world is just sloganeering, it never leads to any change, because where is the world? There is no such thing, just you and me, and many people like you and me. If you and me are transformed, the world is changed. Instead of doing that, we are always doing this, because changing individual people is a long haul. I must tell you can I tell you my tragedy?
Yes, sure.
When this almost more than 38 years it's going to be this September 23rd. 38 years ago, I just sat in one place and suddenly realized if I don't mess with my mind, I'm just ecstatic, every cell in my body is dripping ecstasy. At that time, the young fool that I was, I planned, On that day, the population was 5.6 billion people. I made a clear-cut plan. In 2.5 years' time, I will make the entire world ecstatic. Because I did not believe nobody will not want to be ecstatic. I thought everybody wants to be blissful and ecstatic, who wouldn't want? But it took 38 years, see how I've become to realize that people are too invested in their misery. You have to coax them out of it. And today, people say we are touching over 1 billion people, but the population also has multiplied to 7.6 billion people. Now I know I will die a failure, but I'm a blissful failure that much I know. Whether what we want to do will happen or not happen, to what extent it will happen, it's questionable. It all depends on individual people willing to be. But this is all it is. What the world throws at us is not our choice. What we make out of it is 100% our choice. This time when the pandemic is on, this is the best time to exercise the choice. Because only in hard times do you realize who you really are, isn't it? When everything is well, everybody can act fanciful.
Sadhguru, thank you very much. Sadhguru, I would just want to ask you something that crosses a doctor's mind all the time, especially in times of this pandemic, and also even without the pandemic when he is dealing with life and death situations. The patients also talk of something called, if I can use the Tamil word, talaividi. And that brings to the question, is the longevity of our lives predetermined?
Now you're becoming a dangerous
As
doctor.
a doctor, when I ask this question, it does not mean that as a doctor we will not work hard and dedicated for every single patient's life. But because some of the religions talk that our lives are determined by the number of breaths. I mean, this is frequently told and floated idea. So is it, we need to learn from you.
It's
Is
good
our
for you.
longevity determined at time of birth?
It's good for you to eliminate this question. Because the moment the doctor asks this question, my patient dies, is it his talavidi? Oh.
I know I was at risk of asking this question, but still this crosses the mind
I'm
all the
sure
time.
from your experience you know, many who would have died are not dead today because of the right kind of medical intervention, isn't it? In 1947, when we got our independence for India, the average life expectancy of an Indian person was 28 years. Today it is 72 or 73, in that range. So obviously we took charge of our death, isn't it? Not that we can get rid of it. I hope that doesn't happen because we must go when our time is up. But we can push it, we can kick the can, definitely. So the very longevity, the very life expectancy is showing that from 28 years to 72, 73 years is a massive change, and it's happened in our country, which is a huge achievement for the nation, and it's happened across the world at different levels. So this idea that somebody dies today, is it his talavidi, is a very irresponsible idea, because if people drive on the street thinking, if I have to die, I will die, then they will kill, unfortunately, not just die. So many people are dying on the street. You know, you've been campaigning for this, both for deaths and broken bones on the roads of India. You've been campaigning for quite some time. So you know, with responsible driving, number of broken bones can be brought down, number of broken heads can be brought down. Just by wearing a simple helmet, you can bring down the number of heads broken, that means the number of lives lost can be changed. So that question is not to be looked at all, because that's an irresponsible way of looking at life. But people need an explanation whenever the death seems to be illogical. You know, when we think, this person should not have died, he was fine, he was good, he was everything nice, but he died, so they think God called him, all right? So people say good people are called soon, bad people are not called, so better be bad, that's what I'm saying. No, if you eat bad food, you're called quickly. If you breathe badly, you're called quickly. If you live badly, you're called quickly. If you live unconsciously, you're called quickly. Otherwise, they will give you enough time. How much time depends on variety of things. As a doctor, you know, there are various aspects involved. There is genetic dimensions, there is atmosphere, there is environment, there is food, there is any number of things. How do you manage to get all these things reasonably right so that you live a full life? That's a challenge of life, physical life. How do I breathe right? How do I eat right? How do I sit right? How do I do things right so that… This is yoga. This yoga is just about this, how to sit right, how to breathe right, how to eat right, how to think right, how to feel right, because all these things have an impact on your longevity. The very way you think and feel decides how long you live. Today, there are so many aspects. For example, because you mentioned the breath, I'm going into this. Normally, a human being takes 21,600 breaths per day. On the equator, this is matched. On the equator, the length of the equator is 21,600 nautical miles. So that is why every mile is counted as a minute. It is counted as a minute. The number of nautical miles and the number of breaths that you take are in some way related, because a human being in the yogic system, we say, there are questions like this which were asked to Adi Yogi over 15,000 years ago. Why can't we evolve? Why can't we grow our brain bigger, body bigger, do something? So Adi Yogi says, as a human being, you've reached a place where your physical evolution is over. You cannot further evolve. Modern neurologists also saying something similar in a different context. But similar things they are saying, that you cannot evolve the human brain to a larger size or increase the neuronal size, but if you pack too many neurons into the thing, you will have intelligence but disturbance and static. If you make the neurons too big, then the amount of energy they consume will be such the body will not be able to sustain. So a human being has reached the peak of evolution, but you can learn to use your evolution in a higher and higher way. This is what the whole entire yogic system is based on, that. Your existing system, how to use it in such a way that other people almost think you're superhuman. But this is not about being superhuman, this is about realizing that being human is super. We are the most evolved creature on this planet, means we've reached a super state compared to every other creature in intelligence, in the whole process of life, because our bodies have come to sync with the ultimate nature of the rotation and revolution. And Adi Yogi also goes out to say, unless there are some drastic changes in the way the planet functions, physiological evolution will not happen. Only conscious evolution can happen within you, and that's why the entire system of yoga. So per minute, a human being is taking 15 breaths per minute on an average. You can lower it. You can lower it by yogic practice, your breath will become slower. As a doctor, you know you have checked many people's chest with your stethoscope. What seems to be a normal breath inside is rasping. Gosh, bush, it's going on, all right? It's a lot of activity. So many air sacs, all of them emptying themselves, filling themselves, is a huge amount of friction in the system. You may not feel that way when your breath is good, but if you're a little asthmatic, well, that's a different process, I don't want to compare that. But as a doctor, you have seen that it's a noisy, frictious activity inside the chest. So as this friction increases, then your perception decreases. So our goal is always to reduce the friction within the system, mentally, physiologically, in every way, so that our ability to perceive is raised. So in yoga, in a very poetic way, they say like this, for example, if your breathing becomes 12 per minute, then you know the language, you understand the language of the birds and animals. It's not that they're conversations you want to listen to, you have much more cohesion with all life. This is why whenever people become silent, they become compassionate to every other life, because suddenly they realize all that life is a part of this existence. It's not just you, it's not just about you. Every other life is actively living and you become conscious of that. If it becomes 9, you know the very language of the planet. When I say language of the planet, planet itself is a living thing, and it's not that it's speaking and having conversation with you, but it is expressing itself in so many ways, in terms of seasons, in terms of weather patterns, in terms of quakes in the, in the tectonic plates, variety of things are happening. You become aware of this. See, many people, right now we are just about to start a tour of a trans-American trip I'm doing on my motorcycle. One aspect is to explore the Native American life. When men just sat there, looking at empty terrain for days on end without any purpose, they became very conscious of how the planet functions, how the land functions. They started speaking in terms of understanding the language of the land. Their religion became entirely that. There's a whole lot of, today's modern ecological sciences are going roundabout to find out the same thing, but all of them knew. And that is so with the Indian farmer also. Many farmers always knew when it'll rain. They will tell you just like that, tomorrow morning it'll rain. Not a sign of cloud, but he will say it will rain and it used to rain. These days they are losing it because they're on cell phone, If your breath becomes 6, the language of the elements, the 5 elements of water, air, earth, fire and space, these languages become clear to you. You understand the elemental nature of life. If your breath becomes 3, you know the very cosmos, the way it is. So it is said like this in a metaphorical way, but this is not far away from factual truth, it is so. Today in the West, a whole lot of people, especially in America, a lot of universities, doctors, researchers are saying, slow breath practices will enhance your health. See, it is not about breathing slow. Breath should become slow. Because you reach a certain level of non-frictious existence within yourself, because you take the body and mind to a certain level of efficiency, breath will become slow by itself. But now even by doing slow breathing, they're talking about all kinds of benefits that they're deriving. Medical community is recognizing this. Respiratory, cardiovascular, cardiorespiratory and autonomic nervous systems are behaving totally differently simply because they're breathing slow consciously. Controlled slow breathing techniques means of optimizing psychological parameters associated with health and longevity and may extend to disease states also. These things have been made by very responsible universities. Slow breathing techniques act in enhancing autonomic, cerebral, psychological flexibility and of mutual interactions between all these different systems. The evidence of links between parasympathetic activity and the central nervous system activity related to emotional control and psychological well-being in healthy subjects have been noticed without any doubt. But studies done on Shambhavi Mahamudra, the inner engineering practices in some of the universities, including Rutgers, Harvard, Indiana University and the Florida University, together they conducted a thing. What they're saying is, the endocannabinoids, the production of endocannabinoids in the body went up by 70%. And the BDNF factors multiplied threefold, 300% increase. So naturally people are feeling wonderful within themselves, because feeling good, feeling wonderful, feeling sweet, pleasant, happy, joyful is a basic factor for your efficiency, for your health, for your longevity, everything. A joyful man wants to live. A miserable man, knowingly or unknowingly, he wants to die. He may not kill himself, but he is killing himself anyway. There's no question about it. Improvement in the way the carbon dioxide concentration increases in the blood, all these things have been recorded. But we are talking about reverse engineering, which is the wrong way to go. They're slowing down the breath and experiencing these things. No. You must bring the system to such a level, breath slows down naturally. Then you will know the wonder of what it is which is what the yogic sciences are all about.
Sadhguru, thank you very much. Sadhguru, of all the upheavals of these pandemic times, mental health and mental upheavals perhaps is the most disastrous. So I would ask you two questions, one from the side of the medical persons and one from the side of the patients. The medical field is actually facing a big problem now because till now, all the sacrifices that they had to do was their family time or leisure time, or they had to work long hours and hard hours. But now the sacrifice is completely different because there is a chance that they may have to sacrifice their life itself. So on one part, they have the duty to their patients. On the other part, they are threatened with the possibility that they are not going to do their duty to their loved ones, their family, the elders in the family, their wife, their children who are whose future is dependent on them. So this is actually causing a big dilemma in the medical field. Doctors, paramedical workers, health workers. So how do we, what is your advice to them?
What I say, they may not like it, but they must look at it truthfully, sincerely, because it's important. These are the times to look at life carefully. See, of various professions that people do, because we are talking about doctors' profession, when you go on, let's say you see 25 patients in a day, maybe 4 or 5 of them are thinking, okay, I paid him, so what about it? But at least 20 of them are looking up to you like God. Yes or no? Something serious they have, they come to you, you fix their bones or you fix their whatever, they're looking at you like that. So suppose you were God, how many hours of duty should you have? I'm saying 24-hour duty, isn't it? So because we are discounting those 4 or 5 hours, 4 or 5 people who may be looking at you, what is it? It's just his profession, is he doing properly or not? So you have 20 hours of duty, that's no sacrifice because you're being celebrated as God. It's a conscious choice that we have made. Now, at a time like this, well, it may be further stretched, I know what all medical professionals are going through. I'm not trying to belittle their services or sacrifice or… I wouldn't like to use the word sacrifice because I never use that word in my vocabulary. I don't think anything is a sacrifice, it's a conscious choice that we have made to do what we want to do. But the significance of the service has become far more significant than ever before, and also probably being recognized by the world like never before. Never before, if a few doctors walked on the street, people would clap their hands and do this. It's happening, it's a wonderful thing. So, for that, there is also a kind of a time demand, and various demands are there upon you. So what can we do? One important thing is to empower the doctors. As a part of this, when it started, the first thing I did was for all the medical personnel, make the inner engineering online free, I said. It costs $150 normally to deliver, but we made it free. Over 130 or 140,000 doctors and nurses have gone through the program around the world right now. So we made it absolutely free. For the patient, we made it 50% cost, taking a big hit on the foundation in terms of its revenue because I thought this is a time where the most important thing is doctors and medical personnel and the the staff around them, they must be resilient. If they throw up their hands in frustration, then situation will go for a total toss. Because even when it started, it was very apparent, many people might have had many misconceptions about what is this pandemic. The fundamental aspect of the pandemic, which Indian government handled pretty well in a way, is to slow it down. With all these lockdowns taking an enormous economic hit, We slowed it down because the only challenge was, suppose the hospital infrastructures and the doctor infrastructure is overwhelmed, then millions will die. The only way is to postpone the infection. Nobody believed we will avoid the infection. Postpone the infection. Without understanding this, a whole lot of people are talking everything has failed, all strategies have failed. No, the whole strategy was to postpone the infection. We don't want suddenly 10 million people coming to the hospital tomorrow, because then the whole infrastructure would collapse. So we have successfully done that. It's building up now as we open up economic possibilities. The numbers are building up and becoming challenging once again. If necessary, we'll have to slow down once again. Maybe again partial lockdowns have to happen. Some time ago as I spoke, you said you were on it. As state machinery and the government starts relaxing the norms, individual people and families and communities should tighten their protocols. Only then this will successfully work. Because the government is relaxing, everybody thinks it's over, then it's going to be a disaster. Once again, lockdown will come to us. Already it's beginning to happen in many countries. Those who thought it's over, it's coming back to them. So the important thing is, as official protocols are relaxed for the sake of economy and social well-being, individual protocols must become tighter and tighter. Only then we will successfully come out of this. Otherwise, we'll stretch this unnecessarily for months on end or maybe years on end, who knows? Because vaccine is only still a dream. It is still up in the air. If it comes, it's fine. Even if it comes, how effective will it be? Will we be able to deliver it to all the people? The reinfection, people who have tested negative again going back into complexities are too many right now. So there is no guarantee that vaccine will be a one-shot solution for everything. I don't believe that. I feel… you tell me, doctor, you must be telling, I'm not me. I feel if we have a good treatment protocol, like tuberculosis was killing millions of people, today we have a good treatment protocol, so we are not afraid of tuberculosis, we are going out and doing whatever we are doing in the world. Because there is a good treatment protocol, we have to focus on that treatment protocol, which is like dengue is killing people, chikungunya killing people, malaria killing people, but it's not stopped us from doing anything because there is a treatment protocol that we trust. If that happens, I feel it's far more reliable than one hotshot vaccine which is going to solve all the problems. Personally, I don't believe that. I don't know, you as a medical person, you must tell me. So regarding this patient-doctor relationship and the extra volume of, workload that's coming upon you, this is the time. I beseech every doctor, every nurse, everybody else. I know these are stressful times. I know many doctors who have not gone home for 6 weeks, 7 weeks. In the same city they're living, they're staying in hotel rooms and going back to the hospital, being fearful of infecting their own families. I know you're going through a lot, but this is the time. You must be resilient, you must be at your best, you must stand up to that oath that you have taken, because this is the time where your work matters.
Thank you, Sadhguru. When this COVID started, in our hospital, we took up the oath that if you join the army, at one day you know you have to go to the war. And so if you're a doctor, then this is the time that we have to show that you are a good doctor. So every single day we have been working as we worked before. Sadhguru, I'll come to it from another point of view of the patient and his relatives. This is also from what you have written in your book on death. You have emphasized a lot on how important it is to do some rituals to your close and dear and near ones. But this COVID has completely changed the whole paradigm. I mean, throughout the world, the loved and dear ones are not able to see the people in the last few days of their life. And this is a very tragic thing which affects them with a lot of guilt. And on the death, the government buries, or some government agency buries them, and you're just informed of a place and a burial ground and a number where you can go and place your wreath or rose and come back. There is no possibility for doing any ritual. So this has two questions. How does the people get over this feeling of sadness that they have not been able to do? And secondly, how do we do anything in compensation for the rituals which we so much believe, but we have not been able to do it?
So that is one of the most painful aspects of this pandemic is that you're not able to attend to people who matter to you. Either in their last moments because they're in the ICU or wherever, you cannot go there, you cannot see them, and above all, after death you cannot see them. It's a very, very painful thing. It's not a small thing. Every day dozens of people that I know are constantly writing to me every day, many dozens of people, of how their father died, their mother died, their brother died, their husband or wife died, but they could not go, buried by the government authorities, how it was done, they have no clue. And when somebody who doesn't have any feeling for that body does it, maybe it's just done as a chore, maybe it's just… I don't know how it is done. So people have seen how carelessly some things have been done, just this turmoil, maybe my loved one was treated like how it was shown on the videos and stuff, some bad things that happened. So this is a very painful situation, and even here in a country like United States where there's so much infrastructure, many bodies were found in U-Haul trucks, beginning to smell. So many people found dead in their homes and picked up much later after they start smelling. So these kind of unfortunate things are happening. But at the same time, I'm not talking about this like some kind of a compensatory philosophy, but we must understand we are the first generation of people who had this luxury that if somebody near dies to us, we can just go there, we can fly there, see them, attend the funeral and come back. This was not there for any other generation before. Because even if somebody died 200 kilometers away, you could not go. It was not easy to go and come just 100 years ago. It was just not possible. It's only in the last 70, 80 years we've had these luxuries that we've been enjoying and not necessarily appreciating, unfortunately. So once again, this pandemic has brought us to this place. There are airplanes, but you can't fly. There are trains that you can't take. There are buses that you can't get into. So once again, it's brought to that place. So it's very, very important that we appreciate all the things that we have, because it pains me to see that this generation of people, though we have so many conveniences, technologies, communications, the way we are complaining about life endlessly is unbelievable. So at least now you understand how people lived in this world always, forever. I'm just asking you, 100 years ago, if your father, grandfather, grandmother, somebody dear to you, even if your child died just 500 kilometers away, would you go and bury him? Do you believe that? It wouldn't happen, isn't it? Somebody would bury them and probably after 6 months later somebody told you he was buried somewhere where you would never go and see, not even go place a flower because you don't know where he is buried. This was the reality. For the first time we've been having all these conveniences but not even appreciating the conveniences we have. Once again this has brought this into our lives, so let's conduct this sensibly and well. And about how important it is to do certain things to relieve these aspects, for that there are ways and methods. Just now we are approaching Mahalaya Amavasya, this is a time, this is a Pitru Paksha, where we attend to all those things. Everybody do this. It is not necessary that somebody recent should have died in your family. Of course in your family somebody has died. In the last 12 generations people have died, don't think nobody died in your family. People have died. And that's why you are here. People have lived, people have died, and that's why you and me are here. So, not only in appreciation, but also in relieving the stress of that disembodied life must be done. Everybody must attend to this. For this we are creating a whole process. We are in the process of… because this is… for all these things, at least in India, people were always going to Kashi. That was the only solution. Now, at the Isha Yoga Center, we are in the process of building what is called as Tenkashi, where all these processes will be available in a scientific way, without any exploitation, properly done, as it should be done. So that, because these rituals have fallen on bad times because of exploitative methods, it needs to be done with utmost sanctity and sincerity. So we're building that dedicated group of people who will do it for the sake of doing it, not for money, not as a profession, but absolutely dedicated people. So this process is going on. In a year or two, this will build into a massive movement by itself. But right now, it is hard times emotionally for many people. It is.
Sadhguru, I just heard a couple of hours ago when you were talking about Amavasai and its rituals. These rituals, are it beneficial to the person who is doing it, or you mentioned about 12 generations before. I was just wondering whether it is still possible that we are connected to 12 generations, or are these rituals meant for the emancipation or development of the person who is doing the ritual?
Both ways, it is both ways, because life doesn't happen separately like that. This keyhole idea of, keyhole science that we have had in the last 60, 70 years or 100 years, looking at everything separately as silos, is no more there. Largely, particularly neurosciences are looking at life as a connected network of… a meta-network of life happening. So in this context, for example, you are here as a doctor. Well, would it have happened wherever you were? Possible, you could train yourself. But what level of intelligence goes into this? What level of culture goes into it? What level of competence goes into it has a lot to do how these many generations evolved. Nobody can deny it anymore. Forever we've been calling this samskara, that there is a collective learning that has happened to us. The impact of it we cannot deny. This is the significance of being born in that country, particularly where we are in the south, because here there is a samskara where we have come with tremendous possibilities. People keep thinking, what is so special about it? You're not understanding what is special about it. The very fact right now that our death rate for this pandemic is the lowest in Tamil Nadu right now. In southern India, it is lowest compared to anywhere in the world. So how did this come? You don't know a damn thing what you're eating. You're just eating what your parents were serving or your grandparents were serving. But they had the understanding what we must eat, because pandemic is not new in the world. Infections, virus, bacterial, other kinds of things have come to us in many forms. Today we make a lot of media about it, we talk a lot about it, but people have faced this in many generations, isn't it? Today everything is documented, recorded, everything seems to be big like that. Otherwise, what is it, nearly 1 million people have died on the planet. 1 million people died 1,000 years ago, you wouldn't notice. You wouldn't notice. Right now, per day, I think the COVID deaths in Coimbatore is around average of 4 to 5 or 6 in this range. 5, 6 people dying in Coimbatore, you wouldn't have noticed many years ago. Today, because every data is there, every information is there, you think it's enlarged in your head in a big way. I'm not trying to belittle the pandemic, but at the same time, the communication impact on your life is very big. So how you are today, the kind of person that you are today is not all you're making, it's a very wrong idea. The self-made men are a treacherous lot of people, okay? They don't understand a damn thing, how previous generations have contributed to their existence. Not only your parents who educated you, not only because of their genetics, because of the whole infrastructure of culture and intelligence and the meta-network that happened around them is still holding us in comfort and well-being. Now, as I said there, it's like a spider's web, all right. A spider's web is one of the most beautiful structures, engineering marvels that you can find in the world. But it must work for the spider, it must catch food for the spider. Suppose the spider itself gets tangled in the net, then it's no good. So this cultural net also is like that. This is one thing that we are suffering in the country right now. Our own cultural net, which is a meta-fantastic net, I would say nowhere else on the planet is it so intricate, so sophisticated and so elaborate. This net, are you going to get trapped in it or will you use it for your well-being? So you need some distance from it. At the same time, it must be available to you. So the rituals are towards that you manage a little bit of distance, but at the same time it's available to you, don't go too far away from it and try to reinvent life once again. Because many things, trillions of simple things that we know today, which we don't even count as knowledge, has come to us because of these many generations of learning, which if you go to other cultures, they're struggling to figure out basic things. Even today, very advanced countries, simple aspects of what to eat is a big debate in United States. Even today it's going on, what is the best food to eat? Every 2 years the opinion keeps changing, universities keep coming and telling different things every 2 years.
Sadhguru, two more questions on mental health because it is concerning all of us. A lot of questions. In fact, I have also asked you once on work-life balance, and probably is it the lack of time that we are always talking time, no leisure time, no family time, no peaceful times. But now we have a situation. The pandemic has thrown up to us for many of us more time, but people don't seem to be much happier with that. There are more. I was just reading, even in China and other places, there are more family discordances and more divorces. Parents and children are together, but there is a lot of family issues. So we have more about what we were complaining that we were having less. But so what is the problem, Sadhguru? I mean, is it the problem is with us? It should be.
I told you there's only one problem on the planet, human being. What's his problem? His problem is his intelligence. If he had half the brain that he has right now, he would be quite peaceful and well. See, every other life is thriving in the pandemic, isn't it? Every other life is thriving in the pandemic. People are shooting videos of peacocks dancing, king cobras on the street, all kinds of things, because every other life is thriving. So the human being is suffering because you have an intelligence which has possibilities beyond your survival. So, if you don't know what to do with this intelligence, it's a big problem. Unharnessed intelligence is a terrible problem. Intelligence should be a solution. Unfortunately, you made it into a problem, what to do? Because if I give a knife into your hand, I know you will do one spinal surgery and save somebody's life. Somebody else either pokes themselves or pokes somebody else. What to do? Same knife? Same knife, isn't it? But somebody decides to stick it into himself or into somebody else. But you could have used it, maybe for surgery, at least maybe to cook some vegetables if you can't do anything better. But that's not how people are using their intelligence. They are using their intelligence to damage their own life simply because they do not even know how to hold this intelligence, first of all. When I say how to hold this intelligence, there's a very beautiful story about Swami Vivekananda. Vivekananda decided he will go west, he will come to United States. In 1893, he wants to come here and spread his Guru's message in America. But he wants to seek Sharada Devi's blessings. He goes and she's cooking something in the kitchen and he says, I want to go like this and take Ramakrishna's message to the world. So Sharada says, Naren, give me that knife. So he takes his knife and gives in a certain way, being who he is. She takes that and she says, you can go. Then he notices that she's already finished with cutting vegetables, the food is already cooking on the stove. He said, why did you ask for a knife? You already finished cutting. She said, I wanted to see how you give this knife. There is a certain way to give this knife. You will see, even today if they're not conscious that way, even today if you go to your village, you ask him for a knife, he will give you like this. He will not do like this to you. Today you ask the young people, many people, very westernized, chuk, pointed part of the knife, they'll give it to you. So if you hold the knife on the blade, tighter you hold it, more it will hurt and you will bleed. This is modern education. They are not teaching you how to handle your own faculties. They're teaching you how to use the phone, computer, microphone, microscope, all kinds of things. But they're not teaching you how to handle this instrument. This is why yoga, this is why in engineering is so vital that you understand how to use this one. If you learn to use this one well, believe me, without a whole lot of technology you can still do well. I'm technologically dumb, but people think I'm very tech savvy because I use this technology. This is the highest technology available on the planet as far as I know. Tell me, is there a better technology than this? You know you have looked inside. You've looked into people's spines, is there a better technology than this?
Sadhguru, you said about handling oneself, but I just read a couple of days ago that there is an increased amount of drug usage and substance usage and alcohol usage during this pandemic times. People are trying to solve their problems through usage of prohibited…
Not solve, dissolve their problems.
And this is especially more in the younger generation. So, but they are going to form the future world. So, what is the solution, sir?
It happened once that Shankaran Pillai was a chronic drunk. So one day he was invited to your Rotary Club to speak, but he came totally sloshed. So his friend who was to introduce him said, he is such a philanthropic person that he's donated all his organs. His heart, liver, kidney, spleen, everything he's donated. Because of that, he largely believes in keeping them soaked in alcohol for preservation. So, people are not seeing how to solve problems. First of all, there is no need to solve any problem. If you pay enough attention, you are the only problem. Tell me which other problem is there? See, in Tamil Nadu, even now if you go into the villages, if you go there, they will ask you, "Saptingla?" Because if you've eaten, what are the problem? Nobody will ask you anything else, because if you've eaten, you're well. What other problem is there? Rest is all self-made problems. Rest is all self-created problems. There's only one problem of survival. So, Saptingla? சாப்பிட்டேன்னா நல்லாதான் இருக்கிறீங்க, என்னென்ன பிரச்சனை உங்களுக்குன்னு? Once you've eaten, what are the problem? You're well, we assume you're well. You should be, isn't it? If survival is a problem, yes, it's a problem. Once that's taken care of, what is the problem? Rest is all, you don't know how to use your own intelligence. So, drugs, alcohol, everything, what we are trying to do, including pharmaceuticals, I'm saying, because the level of pharmaceutical consumption, whether it's prescribed or not prescribed, whether it's from the back street or from the shop, the level of chemical consumption is disastrous. Whether it's in agriculture in the form of fertilizers or pesticides, whether it's in the form of prescribed medications that are going on the over-the-counter or backstreet hallucinogenic stuff going on, all of them are chemicals. How much chemicals are you using and for what? See, right now, if you want to be healthy, healthful, you need chemicals. If you want to grow food, you need chemicals. If you want to be peaceful, you need chemicals. If you want to be joyful, you need chemicals. Well, for everything you need chemicals. But the greatest and the most sophisticated chemical factory is here. You know this, huh? I don't have to tell you. This is the most sophisticated and complex chemical factory on the planet, doing trillions of chemical reactions in a minute or in a moment, which nobody else can do. Now the question is only, are you a great manager of this chemical factory or are you a lousy manager? That's all there is. Because you're a lousy manager, you're importing from outside and putting, you want to be joyful, you want to drink or you want to drug. Well, as I told you, research is showing that just by doing simple inner engineering practices within 90 days of practice, 70% increase in endocannabinoids. I'm telling the youth, come to me, I will have you always stoned. No, you don't have to buy any substance, you don't have to be arrested by narcotic bureau, nothing. Just sit here and always be blissed out. Look at me. So if you are chemically well managed from within, what will the pandemic do? Pandemic is an economic problem. Pandemic is a social problem. Pandemic, if you contract, is a physiological health issue. Psychological issue is just your making, isn't it? We need to understand this. We should not do any namby-pamby counseling for people, don't worry, this will happen, we'll take care of you. No, everybody must understand that their psychological health is entirely their responsibility. The same goes for physiological health, but right now you could contract it just about anywhere, in a workplace, in transportation, wherever. But that also, both physiological and psychological health is absolutely your responsibility. When it goes beyond that, we've done everything right, something goes out of control, then you need the doctor. But you think doctor should manage your health on a daily basis. No, life doesn't work like that.
Sadhguru, one last question. All of us are looking forward to the end of the pandemic, the end of the lockdown. And when we come out of it, we should not forget the lessons that we have learned from it. And we are looking for renewed lives. So what is your message to all of us for the end of the pandemic? I hope it comes soon, and I hope all of us are ready and we don't waste what we have learned from this period.
In my opinion, the end of the pandemic will not come like how the end comes in the cinema and lights will come on. The end of the pandemic can be today for you. If you behave responsibly, the pandemic has ended for you. Your personal protocols are 100% means there's no pandemic for you. Like this, every citizen has to bring an end to the pandemic, that you don't get infected. Just in case it happens, you make sure it never goes to one more person. If you do this, pandemic has already ended for you. There's no one dramatic end.
Yes.
Namaste.
Thank you. Thank you, Sadhguru.